Hi, everybody. My name is Ronit Ridberg, and I am a research assistant professor at the Food is Medicine Institute at the Friedman School of Nutrition Science and Policy at Tufts University, along with my co-authors at the FIMI and at the Center for Health, Law, and Policy Innovation at Harvard Law School. We published Food is Medicine in the U.S., a national survey of public perceptions of care, practices, and policies. While food has been used for millennia to sustain and promote health, the term food is medicine, or FIM, today refers to a suite of nutritional services and food-based interventions integrated into healthcare delivery to treat or prevent disease. The most common of these programs are medically tailored meals, medically tailored groceries, and produce prescriptions. But despite growing national momentum surrounding FIM in both public and private sectors, until now we knew very little about public perceptions and awareness of the relationships between food, health, healthcare, and food as medicine. We surveyed 3,009 individuals across the United States between February and April 2023, with a sampling strategy designed to reflect the demographics of the 2020 census. And overall, our survey found that across geography, race, ethnicity, and income, respondents agreed that food has a direct and important effect on their health, that the provision of healthy food should be considered in our treatment of diet-sensitive chronic disease, and that food as medicine should be covered by health insurance. In fact, more than half agreed that they'd be interested in participating in a medically tailored meal, grocery, or produce prescription program. However, a large gap became evident when we asked questions about the experiences people had in their healthcare encounters. So less than half agreed that their healthcare providers gave clear advice about food and nutrition, and even fewer, less than a quarter, reported that their providers asked whether they had enough food to eat. This gap widened for those with Medicare or annual household incomes below $25,000, who were even less likely to report conversations about diet or sufficient food with their healthcare providers. And though half of respondents shared a diagnosed diet-related condition like type 2 diabetes or hypertension, only 17% had seen a registered dietitian nutritionist in the prior year. Our findings suggest several areas of need, including increased nutrition-related training of healthcare professionals, development of food as medicine-related accreditation standards for healthcare organizations, and accelerated policy adoption to support the expansion of food as medicine in healthcare delivery. Together, such efforts will help us address poor nutrition, diet-related illness, and rising healthcare costs. And the findings I shared here are just a really tiny sample. We asked questions about motivations for behavior change and barriers to healthy eating, and much, much more. You can read the study in the April special issue of Health Affairs on food, nutrition, and health. And if you're excited, as I am, to get into the weeds of the data, you can access our complete survey results in the online appendix.